What are the precursor conditions to myeloma? How are MGUS and smoldering myeloma defined?
So what is MGUS and smoldering multiple myeloma? So these are precursor conditions to multiple myeloma. These are patients with these precursor condition are asymptomatic and have a higher than average lifetime risk of progressing to overt multiple myeloma. And they're characterized based on a continuum. So MGUS is the earliest stage, which is typically characterized as a patient having less than 3 grams per deciliter of an M spike and less than 10% plasma cells or cancer cells in the bone marrow.
What is smoldering myeloma?
Smoldering multiple myeloma is a slightly more advanced state prior to the development of overt multiple myeloma, and that's characterized by an M spike of greater than 3 grams per deciliter or 3 or more grams per deciliter, as well as a bone marrow plasma cell percentage of 10 to 60%, with the absence of other features that might define myeloma, which we often think of as a myeloma defining event, like a very high serum free light chain ratio, or a focal lesion on an MRI, or organ damage, which would be CRAB criteria for multiple myeloma.
What is high-risk smoldering myeloma?
So what is high-risk smoldering multiple myeloma? So high-risk smoldering multiple myeloma is typically characterized based on an individual's likelihood of progressing to overt multiple myeloma in the near future. And we use several key clinical metrics to understand a patient's risk. This might be how high their serum-free light chain ratio is, how many plasma cells they have in the bone marrow, how many cancer cells they have in the bone marrow, as well as an individual's M spike. And individuals with 2 or more of those features we tend to think of as at high risk for developing multiple myeloma, and these are often patients that we think of as key candidates for clinical trials.
What is the PROMISE study? Dr. Marinac just described the Mayo 2018-2022 model. The Mayo Clinic 2018-2022 model includes serum biomarkers and a bone marrow plasma cell burden of more than 20% as risk factors. The IMWG validated the Mayo Clinic 2018 model with a cohort of 1996 patients, and the 2-year risk of progression to myeloma or amyloidosis in low, intermediate, and high-risk groups was 6%, 18%, and 44% respectively. Risk factors in the older Pethema model include the presence of immunoparesis and the percentage of plasma cells with an aberrant immunophenotype. However, the requirement for multiparameter flow cytometry makes the Pethema model difficult to implement clinically. Although the Pethema and Mayo Clinic 2018 models are used in clinical trials and practice, the classification of high-risk smoldering multiple myeloma is significantly discordant between the models. Therefore, to further optimize risk stratification, the IMWG recently developed a risk stratification model incorporating high-risk cytogenetic markers translocation 414, translocation 1416, a gain of 1q, monosomy 13 deletion, 13q, and more refined criteria for risk factors included in the Mayo Clinic 2018 model. Using the IMWG 2020 model, intermediate and high-risk patients with smoldering multiple myeloma had a 2-year risk of progression to myeloma or amyloidosis of 51% and 73% respectively.
So PROMISE is a nationwide screening study for individuals at higher than average risk of developing multiple myeloma or its precursor condition within their lifetime. It's really based on the premise that detecting multiple myeloma at its earliest stages, at the precursor stages, is going to be really critical to preventing it and helping a person live a long, healthy life. And so PROMISE enrolls individuals who are over the age of 40.
Since the recording of this video, the age to qualify for the PROMISE study screening is 30 or over.
And are either Black or African American, or have a strong family history of a blood cancer or blood cancer precursor condition like MGUS or smoldering multiple myeloma. Now, individuals that are interested in PROMISE study can enroll in PROMISE through our website, promisestudy.org, sign up, take a brief eligibility survey, consent to the study, and we ship them a kit that they need to take to a Quest laboratory to collect their blood. It's sent back to us, and we share the results with patients.
Is PROMISE a one-time study?
No, it's not. So if a patient enrolled in PROMISE screens negative, we'll rescreen them in the future. If a patient screens positive for a precursor condition, they meet with a clinician as part of our study team, typically a research nurse or nurse practitioner. We provide them education, information that they need, and the resources that they need for appropriate follow-up care. And we also follow them over time, because the more patient information that we have about myeloma and its precursor conditions, the more that we can design studies that are going to help patients.
What are some initial findings from the PROMISE study?
The first 2,000 patients in the PROMISE study, and one striking finding that we identified is that precursor conditions to multiple myeloma are very common, not only in the general population, but particularly it's about twice as common among individuals who are Black or African American or have a family history of blood cancer or blood cancer precursor condition. And so that is remarkable to us, is that many patients in the country, millions of individuals, have these precursor conditions to multiple myeloma but don't know about it.
Dr. Robert Kyle has cataloged patient histories, archived blood samples, and observed a vast number of people with plasma cell proliferative disorders for more than 60 years.
Was reviewing the history of a patient named Mrs. Ahlstrom, who had been seen at the Mayo Clinic 19 years before because she wasn't feeling well. She was worked up and found to have an increase in the globulins in her blood. But that was as far as one could go at that particular time, and she was told to go home, that her blood work was otherwise good. She returned 13 years later, at which time serum protein electrophoresis was doable, and this showed a very large spike in her serum of about 2.9 grams per deciliter, and she remained asymptomatic, and again was told to go home and enjoy life. Then she, 7 years later, developed symptomatic multiple myeloma with bone pain and all sorts of the problems, and had myeloma, was treated with 2 of the alkylating agents, the only 2 that were available at the time, had some minimal response, and unfortunately died about 9 years later. We have followed a cohort of patients with monoclonal gammopathy of undetermined significance, MGUS or MGUS, for 40 years, and over that period of time we found that almost 1% of these persons progressed to symptomatic multiple myeloma requiring therapy, Waldenstrom's macroglobulinemia if they had an IgM monoclonal protein, or AL amyloidosis.